All right, thank you again for joining us for today's event. And we're going to be talking about cervical fusion and discectomy, and this is a live question and answer session for you. My name is Mary Sue Gardner. I'm a registered nurse on the Provider Outreach and Education team, and I'm going to be your facilitator for today's event. I'm also joined today by other members of Provider Outreach and Education, and as well as members from our medical review department who are going to be helping with the question and answers. A few housekeeping things as we get moving. On our webpage, WPSGHA.com, we have a training center. So hopefully this is where you all went to register for this live event. In our training center, you have access to training materials, you have the ability to register for upcoming events, as well as access encores, which are the recordings of our live event. We post our most recent encores to our training center page, and we actually have a built-in YouTube player on that page. So you can watch those encore events for around 60 to 90 days from our website without having to actually go to YouTube. So again, they're generally available on that page for 60 and 90 days, but they're always going to be available on our YouTube page until a more current item replaces it or a more current training. All right. If you have any feedback about your experience today, there's going to be some opportunities during this presentation to take our survey. So if you're listening to the encore of this event, watch for that survey link to pop up at the top of the screen at various points throughout the event and at the end of the event. And for those of you on the live event, Jennifer has also placed that link in the chat for you. The CMS Qualtrics survey is actually your opportunity to give us feedback about our event. So we want to know about your experience with this event. That survey is your opportunity to not only tell us about your satisfaction with our event, but to also let us know what additional education you want us to provide in the future. All right. So as we move on, this is our disclaimer. For every event, we have to show it, which basically means the information we're going to give to you today is as current as the Medicare rules are today. But it's your responsibility to make sure you are following the Medicare laws, rules, and regulations because they do often change. All right. My overall objective of today's event is to help you with those questions and answers that you have about cervical fusion and discectomy, especially with the prior authorizations. So we are going to review some pre-submitted questions, and then we are going to take live questions and answers. So you can start placing your questions in the chat at any time you want. You may find that through the pre-submitted questions, I do answer some of your questions, but that's okay if if you put it in there and I answer it, we'll just skip over it. Let's see. Let's go ahead then and just roll into getting started with the pre-submitted questions. So the first question that we received is prior authorization always required for cervical fusion with disc removal? And the answer to that is the prior authorization is required for that procedure if it's performed in the hospital outpatient department and billed on a 13X type of bill. And then we would be looking for the specific CPT codes for that, the 22551, which is the fusion of spine bone with removal of disc at the upper spinal column, anterior approach, and the 22552, which is fusion of the spine bone with removal of the disc in the upper spinal column below second vertebrae of the neck, anterior approach on that one as well. And that's for each additional space. So it's not required for procedures performed on an inpatient basis or procedures that are through an ambulatory surgery center or in a critical access. All right, the next question we received is, what is the process for obtaining prior authorization? So the process for obtaining prior authorization can be found in several different WPS resources, actually. First, you can read the article on our website, and there is an article that is entitled Prior Authorization for Hospital Outpatient Department Services, and we are actually going to just show you where you find this information. Give me just a second to pull that up. And I am actually just going to start out so you guys can see exactly how to get there. If I go to WPSGHA.com, I need to choose a Part A, part of Medicare. So either J5A or J8A, because this is a Part A prior authorization review. So I'm just going to choose J5A for this purpose. I'm going to go to the topic center, and I'm going to pull up medical review. And I am going to go to the prior authorization. And this is the general overview of all prior authorizations. So you can see in this general overview, we have additional information about all the services for the hospital outpatient department prior authorization process. And as we scroll down, and I'm trying to not move so quick as to give you a seizure, we are going to get to cervical fusion and disc removal. And here's where you're going to find the CPT codes that are under review, as well as what documentation that needs to be submitted. But we have some additional information. So we have an article that's just specific to prior authorization with cervical disc removal updates. So here's where you can find all things just for this service. It gives some background information, it gives you documentation requirements, and it gives you some of the medical necessity information that is also located in our local coverage determination. The end of the article also goes through some of the limitations and exceptions. If I take a step back under that general article, scrolling down slowly, you can see we also link you to the Medicare coverage database so you can view the local coverage determination for cervical fusion. So if you use the link, that's provided on that page, you can be assured that it's going to take you to our LCD. Jennifer also posted that link in the chat for you. But the one thing I do always encourage providers to do is just go over here and click on this down arrow for contractor information and make sure you are reviewing a WPS article, local coverage determination or local coverage article. So all of those things that I showed you from the WPS website and the coverage criteria are also available here in our local coverage determination. We just tried to give you some one-stop shopping on our website as to where you can find some of those coverage determinations and limitations. The other thing I do want to tell you is at the bottom of each LCD, and then you can look away if this is hard on your eyes. I'll be there in just a second. Is our local coverage article. So that is where you are going to find the billing and coding information. So we do have a local coverage article, which is A59664, A meaning article, which is going to give you the billing and coding information. And then it's going to give you some information about the CPT codes. If there are ICD-10 codes that have to be present, that information will be there as well. But remember, for the prior authorization process for the cervical disc removal, it only includes those 2 CPT codes that are listed here. These are the only ones that require prior authorization. All right, so in order to obtain prior authorization, what do you need to do? Well, first of all, you need to make sure you have all the covered indications, all of that information covered. Make sure your documentation supports your coverage indications. Once you know you have a patient that meets the coverage criteria, that is a good candidate for the prior authorization process, all the medical necessity you believe is there and is going to be met, then you would submit your prior authorization request. If you are a hospital submitting your request, you can log into our patient portal and fill out the information in the patient portal about submitting a request. I can't log into the portal because obviously if I could, that would reveal protected health information. So we can't do that. But what I can show you is where you can find additional information about prior authorization. So you would scroll down to the prior authorization part of the portal user manual, and here's some information about prior authorization in the HOPD, and then it's going to give you some pictures about how you navigate those steps in our portal to get your documentation submitted and to complete your prior authorization request form. I'm going to go back to the home page and I'm going to go to forms, and I'm just going to show you what that form also looks like from the hard copy form. So if you don't have the ability to submit via the portal, which is the preferred method, you can also submit with a hard copy form. So you would have to fill out all of the information on this form. You're going to tell us you're doing the cervical fusion with disc removal. You would include all of the facility and physician information, as well as all of the information about the beneficiary. And then down here is where you're going to tell us about what HCPCS codes you are submitting prior authorization request for, if you need any modifiers, and how many units of service you anticipate billing. Now, since those 2 CPT codes don't give a lot of description, you really need to utilize this additional information section and give us that additional information, like at what level you plan on doing this at, or levels. All right, so that's kind of a nutshell about how you submit that. Once it is submitted, if you are a portal user, you can check the status by logging into the secure section of our website. And if for some reason you do not get an affirmed decision, which is something you need in order to perform and bill that to Medicare, that facility needs that affirmed decision with a UTN number, you can resubmit and add additional information, and you can submit those requests in an unlimited amount of time. All right, so let's talk a little bit more as we go through about some of the other questions that have come in. And we're going to bounce back and forth a lot into the website, et cetera. Anytime I can show you how to locate a resource or how to find additional information, I want to show you that as well. So the next question that came in is, what should providers do in case they receive a denial? Before I answer this, let's differentiate between a non-affirmed prior authorization decision and an actual denial. When a provider submits a request for a prior authorization and the nurse reviewing it determines that the request is not valid or not medically necessary as submitted, they will not affirm the prior authorization request, which means that you are not given the green light to perform and bill the service. If you do and you don't have an affirmed UTN for proceeding with that procedure, the claim will deny. So a non-affirmed decision can't be appealed because there's no claim submitted yet. So it's nothing that is appealable. It's a provisional review of a service that's yet to come. So by us non-affirming it, it just means we're saying not at this time. Your documentation doesn't appear that it's going to support medical necessity of the services at this time with the documentation we have. So with non-affirmed decisions, you can just simply resubmit and include more information as many times as is needed. We do encourage you to follow all the information listed on our website on what you need to submit to, and also review any of that prior authorization education from other events that we have posted on our website. That way, you know what you need to do, and you get a better understanding so you can get an affirmed decision on the first attempt. Also, the senior nurse analyst will call to educate and assist after a non-affirmed decision has been made. This is to help our providers to be as successful as possible in obtaining a prior authorization. So if you do get a call, take it. Take that education. They're out there, it's a big frustration when they issue a non-affirmed decision and they try to reach out to you and tell you why and maybe what else is needed, and no one takes the call. So if you're the one making the prior authorization request, make sure you're also willing to take the education in case your request doesn't get affirmed. All right, so now let's switch. A denial. A denial is made on an actual claim submission, and it means we're not going to give you Medicare money for this claim. So if a provider did not submit a prior authorization request and performed that service without that affirmed UTN, again, that claim will deny. So ironically, these don't have appeal rights because you did not submit a request prior to performing the service like you're supposed to, because that's part of the coverage criteria. But there are other instances which you could receive a denial even if you have an affirmed prior authorization. So let's say we affirm the decision, but when you billed, it hit a system edit for something else that made the claim deny. In that case, you would have appeal rights. Again, remember our senior nurses are there to help you, so take the education that they try or that they give you if you happen to receive a non-affirmed decision. All right, the next question that came in is WPS seeing cases that do not meet criteria, and what are the most common reasons for not meeting? So one of the big reasons is the symptoms and myotomes don't match for the level requested. Remember, myotome testing is an essential part of that neurological exam when there's suspected radiculopathy. Myotomes are much more complex than dermatomes, since each skeletal muscle is actually innervated by nerves that are derived from more than one spinal cord level. So when reviewing for myotome testing, our reviewers know that different areas and tests are going to lead the physician to different levels of the spine that may be affected. For instance, if you check shoulder abduction by asking the patient to raise both arms to their sides and have them do that simultaneously, like as strong as they can, while the examiner's, providing some resistance to this movement, the examiner would be comparing for strengths of each arm. And if there is clinical findings, that could indicate like a C5 issue. So we have an expectation that you are doing the myotome testing, that the myotome testing is consistent with the symptomology that the patient's having, and that the physician's documenting what they are finding and what level they are suspecting is an issue. Under decompression of symptomatic cervical canal stenosis, when you're using arm pain that is moderate to severe for a minimum of 12 weeks that failed to respond to conservative therapy, we're also not seeing that it's supported by at least 4+ on a visual analog scale for this period of time. So we have to see the patient's amount of pain in objective and measurable terms, and we want to see it for at least 12 weeks. And that's another issue that we're not always seeing documented. Remember, anytime you can give us objective and measurable information, it's only going to behoove you and your plight to get a prior authorization in. To tell us that, to give us the patient's subjective information to you that, like, my arm hurts, or my arm pain's severe, or it's been going on for weeks. That doesn't give us the information that we need. You need to go back and ask those qualifying questions and provide quantitative information to support those. Okay, I know you've been having pain, so on a pain scale, what is it? If you rate from a 1 to 10 scale, like on the visual analog scale, have them report that, ask them to follow up with that with each visit, and then, document what they're doing that is not providing any relief. What other things have you tried? And then under that same question, the most common reasons, interpretation of the imaging. So imaging reports must be present in the documentation, and they're really pertinent to support this procedure that you plan to perform. So if the surgeon makes an interpretation of the report, that documentation must be included in your overall documentation. A surgeon shouldn't be amending a report made by a radiologist. Instead, the surgeon should make their own interpretation of the findings based on their expertise, and their impression should be a standalone. Again, not an amendment of someone else's interpretation. We just don't want to see that being done. But we do need an interpretation, and it should be the surgeon, the one that's actually going to be operating. Their medical expertise should drive them to interpret the imaging reports. All right, moving on. The next question just came in, and it said they were looking for detailed info on coverage criteria. So again, we kind of hit that already, and where to find that information. You can find it in the local coverage determination, and you can find it from the WPS website. We showed you those different portions of our website of where you can find it. And remember, the most critical thing, I'll pull it back up, and go to WPS-GHA, is to make sure you're on a Part A side of Medicare, of one of our jurisdictions. Either J5A, if you're Nebraska, Iowa, Kansas, Missouri, or one of our national states, or J8 if you, whoops, I keep pushing or pointing at Part B, but I mean Part A here. If you are Indiana or Michigan Part A, because this is a Part A procedure, or Part A process. Remember though, physician's office can submit a request on behalf of a facility if they choose to. Now, you're not going to be able to log into the secure section of our website and make that request, but you could use the form that's available. But remember, it's not needed for the physician's office to bill because the unique tracking number and the affirmed decision are for the facility to perform the service. So if you submit on behalf of a facility, you have to share all that information with them. You have to give them the unique tracking number. You have to make sure that you are submitting all the documentation that is required, and that they know as soon as you know if you submitted that request on their behalf. All right. And then remember, you know, like I said before, I hosted an event in July and I shared that link with you, so you can always find additional coverage criteria there as well. All right, moving on. And I'm just checking over in the chat to see if anyone's popped in anything additional. And remember, you can put information or questions that you have in the chat. Let's see. What documentation is required for exceptions to conservative therapy? For that, let's go back to the LCD. And I'm going to scroll quickly, so I'm going to look away for a second if you need to. All right. So as I mentioned before, the coverage criteria and coverage indications, as well as the limitations, are all listed in our LCD. But if you go down to the limitations section, this is where you're going to find all of that information about the exceptions. And as we scroll on, so we're under exceptions and then limitations. So we scroll on, and here are the exceptions to conservative therapy requirements for decompression of symptomatic cervical canal stenosis. That's a mouthful. All right. So again, myelopathy, radiculopathy, and if there is loss of bladder or bowel function due to cervical spinal cord decompression. So again, jump back here and make sure you are following everything that is listed in the local coverage determination for you. All right. Next question. I'm sorry, I'm just scrolling down, so that's why it takes me a few seconds sometimes. Is there a cutoff date for imaging? So the policy does not specify a cutoff date, but it should be consistent with the current symptoms and episode of pain. So if the pain is unchanged from prior imaging, it would not be expected to be repeated. But if it's new or changed from previous symptoms, it may be necessary to repeat your imaging. So documentation as to the timing of imaging, if the images should be included, if the image studies are not recent, or if they're repeated to support medical necessity, all of that should be documented. You know, if you have to repeat, tell us why you feel you need to repeat. Is there additional symptomology? Again, keep it within this current episode of care. Now, to submit imaging that's 5 years old may be a little beyond this current episode of care. So you would want to consider that as well. All right. So the long of the short, you know, the LCD doesn't give you timing, but make sure it's relevant to your patient's current symptomology. Let's see, the next question. What are some things I can do to help get an affirmed decision on the first try? Well, these are all good questions, but I'm going to jump back to here. Use our prior authorization request form. So, you know, whether you're submitting it online or you're submitting it, you know, with the downloadable form, make sure you are using the form and make sure you are completing that form in its entirety, including the additional information section. So that's where you're going to tell us what levels, et cetera. Let's see, be sure to include your MRI interpretation of the clinical and the MRI and the interpretation of the clinical findings. So again, if the surgeon notes findings that are different than the radiologist's general interpretation, the surgeon should be making their own interpretation and not amending. Next thing, be sure that you include one of the 3 covered indications, and they're listed in the LCD. So these need to be present and submitted with your documentation in your prior authorization request. And finally, if you're a physician's office and you're submitting on behalf of the facility, you must include all required information on the prior authorization request. So that means you have to have the facility's PTAN, you have to have the facility's MPI, name, address, etc., their fax number as well. All of this, you can't skip this information. That all needs to be submitted, as well as any documentation that would come from the facility that would need to be submitted with the request as well. So basically, the biggest things to getting an affirmed decision on the first try, you know, are really following the information that we have out there already for you. Go to our website, listen to our old education, go to the medical review section of our website on the prior authorization request. Make sure you are following all of the information that's necessary here. And make sure you are submitting a request for cervical fusion for hospital outpatient department. It's a waste of your time if you're not submitting, if you're submitting for a place of service we don't review. So we don't review or have a prior authorization process for a physician's office. We don't have a prior authorization process for an ambulatory surgical center. Critical access hospitals are not included, so we don't have a prior authorization process for that. And if you think, well, I'm just going to submit it just in case, well, it's a waste of your time and it wastes our time, because then we have to go through just to say this isn't a valid request. I do see a question came in. It said, what is the facility PTAN? So a PTAN is a provider transaction number. You would have to contact the billing department from the hospital and ask them what their PTAN number is. So the request has to be completed in its entirety. So I think it was Shay asked that question. You're going to have to ask that facility what their provider transaction number is. All right. Good question. All right, so then we got some questions that are a little more billing specific, but I'm going to go over them as well. The first one is, can a provider utilize a biological into the repair for the cervical fusion disc removal? And the answer to that is no. Not for Medicare purposes and Medicare coverage purposes. The use of biologicals aren't covered, and you risk denial of the entire claim if you are doing that. There are currently no FDA-approved biologicals to be injected into the joint at the time of the surgery, so the inclusion of a biological or other non-FDA-approved substance in an injectant will result in a denial of the entire claim, and that's based on information from the benefit policy manual. And that is actually in Chapter 16, Section 180. And I'm going to go ahead and just put that into the chat if anyone is actually interested in where to find that information. All right. That again includes amniotic and placental derivatives for injectants, or any amino acids or vitamins, or even platelet-rich plasma all fall into this category. Now, things are always changing. Medical interventions are constantly changing and becoming better. So it doesn't mean that some of these things might not at a later date be approved. They're just not approved by Medicare at this time. So, you know, if you are a facility that's advocating for some of those, like the platelet-rich plasma, to be added, you know, continue to fight your fight. And Medicare may one day, you know, choose to add that in once it's FDA approved and there's more clinical data to support the use of that. All right. The next question that came in is how to proceed with getting paid if CPT and hard-coded ICD-10 don't align. So basically your CPT and ICD-10, they must align. And so follow the local coverage article, but they have to align if you expect payment. And I know we're getting close to time, so I'm just going to kind of show you or go through one more question here, and then I'll look over at any other questions in the chat. We did get this question kind of a few times about add-on code 22614 being included in this local coverage determination. Providers are saying they're having some lumbar and thoracic spine surgeries that contain this code, and they're being stopped by their clearinghouse due to not containing a cervical diagnosis. And the clearinghouse is referencing back to our local coverage determination and local coverage article. So they're just wondering about what they can do. So this is that code. First of all, that code's not in the prior authorization process, which is fine. It is something that is in our local coverage determination and our local coverage article, I should say, but it's a clearinghouse issue. So if you're having issues with the clearinghouse stopping your thoracic and lumbar surgeries, you need to speak with the clearinghouse about it. Or the other option is find out how you can bypass the clearinghouse recommendation, as this code is allowed when it's appropriate with the cervical. So we can't change how your clearinghouse has put in that front end edit. But we do encourage you, if you are working with a clearinghouse, that you ask them if there's something that they can do to help, so they're not always making a suggestion and halting your claim from processing for those thoracic and lumbar. All right. So I'm just looking over at my notes, and some stuff I wanted to make sure I showed you was the prior authorization overview, the portal manual and link, and then at the end of this page, the general information about prior authorization. We do provide you a link to the CMS operational guide as well as frequently asked questions that they have posted on their website. So I am looking at the chat, and I'm not seeing any additional questions have come in. So I am going to, okay, here's one. We are getting denials for the article edit. Was told the article would be updated for this issue of 22614. And was that for cervical or was that for thoracic and lumbar? Elizabeth asked that question. Lumbar and thoracic. All right, so you're getting the actual Medicare denial. So it's hitting and denying payment. It's not a front end issue. Okay, so there's some, just looking at the responses. I will send the information. I'm going to have to look into it a little more if you're actually getting a denial. So if you're going ahead and already bypassing the clearinghouse and submitting it for your lumbar and thoracic and you're still getting a denial, I'm going to have to do a little research on our end to see if there is another issue that's causing that. But if it's just an issue with the clearinghouse, then, you know, like I said, the workaround is how do you work around the clearinghouse? How do you get your claim actually submitted to Medicare? But you're saying that it's not just a clearinghouse, you're getting the actual denial. So, Elizabeth, I will look into that more. I'll take that back to the claims department and see if I can find out anything. And if I do find anything, I'll send, you know, the answer out to everyone so you guys can all know what the answer is to that. All right. Perfect. So again, this is just a copy of the encore presentation where you find that information on our website. Another thing I want to tell you about is that the IVR, or the Interactive Voice Response Unit, eligibility is being discontinued. So it's just looking at the beneficiary eligibility information on the IVR. There are other ways to look up eligibility, and that includes our secure side of our portal and the DDE, as well as the HEC system. So please note that this is actually incorrect. We've made the decision to disable this function by 1/1/25. MACs were given the opportunity to go out as far as March, but we have determined that we're going to do that again as soon as 1/1/2025. And this is really just protecting beneficiary information, making it more secure so people can't get to protected health information. If they find that the pilot for this just doesn't work, then we will, since it's just being disabled, we will have the availability to turn it back on. All right, and then finally, you're going to get an email. It may already be in your email address or email box, that is your proof of attendance. So that also contains a certificate of achievement contact hours should you need those. It gives you information about the survey and completing the survey, and we do encourage you to take our survey and complete our survey. It's your way to tell us what you liked, what you didn't like, and what you need in the future is what's most important to that, what additional education you need in the future. If you have any follow-up questions that I didn't answer, and I'll relook at the chat and send those out if I missed something, but you can always email those to us at wps.gha.education@wpsic.com. Make sure you put cervical fusion or something to the fact of that, the question and answer session, and send those to us within the next week, and we will find you an answer. If you have claim-specific questions, you, again, will need to submit those to customer service, because we can't look up your claims, unfortunately, and we can't risk you sending protected health information through the internet either. Again, just a little bit about the survey. We do encourage you, please take some time and let us know what you liked and what you need more of in the future. And when I turn off the webinar, the site is going to direct you straight to our survey if you want to complete it then. All right, I know we've gone over. I apologize for that, but such an important topic and such great questions that have come in. So on behalf of Jennifer and myself, as well as Medical Review, we want to thank you for your participation in today's event. So this concludes our webinar, and you may now disconnect.